Hey, what is going on, you guys? I hope you all are doing well. This is Dr. DeLon Canterbury, CEO and president of GeriatRx. I hope you guys are having a fantastic week. I have been on cloud nine again. I'll say it again. I am loving my cohort. I am loving their energy, and I'm so glad that we have successfully completed our first launch of our Deprescribing accelerator. So super stoked. Well, we have three amazing people. Dr. Judy Waldman in South Dakota, who's a holistic health coach, as well as a fellow pharmacist. I got Miss Sharon Fant, who is a living testimony of her own deprescribing journey and how she beat diabetes as a health coach and diabetes educator. And then I also have the lovely Miss Charlene Sparks, who is also the founder of Women with Vision, which is a caregiver group meant to help support those caregivers out there who don't have access to resources in the senior space. So these phenomenal women have joined me on the Deprescribing Army, the mission and movement, the future of healthcare, to literally stop and unnecessary treatments in our seniors, reduce medication harm, improve health outcomes, and of course, get better quality of life for our most vulnerable population. So really, I believe deprescribing is the future. I believe this needs to be the standard of care. I believe this needs to be taught in all of our schools, whether it's pharmacy, whether you're just a care provider. I don't really care who you are. If you're touching patients' lives that are in this demographic, everyone has the ability to be a deprescriber. Of course, your pharmacist can definitely help, your doctor, your regular clinician, but people don't quite know the power of deprescribing. And a lot of it starts with having that dialogue with your patient. If they don't know how to speak up for themselves, then of course, there's nothing to deprescribe, right? We're not going to have any problems to solve for them. So a lot of this needs to be seen as a layered team-based approach. Not only do we have to talk about the patient perspective here and what the provider believes is appropriate to stop safely, but we have to tackle the underlying issue, which is our healthcare system is still really broken. So we have to change policies. We have to change things from an administrative level to incentivize quality. And I mean quality outcomes, quality care, tangible results that can show that this is doable. And guess what? Our Deprescribing Accelerator will show you how this is possible. It is doable to get grant funding for deprescribing. It is doable to incentivize a service-based or subscription-based model talking about deprescribing in the community. It is possible to influence other medical offices to change their way of thinking and how they deliver care. So our seniors, again, are sent to the hospital every day. And there are about 750 people that are sent to the ER because of a preventable medication side effect. So keeping this in mind, we are not doing our due diligence in our healthcare system to meet the needs of this demand. We have a growing senior population. We have less geriatric care providers. So this spells opportunity for those in the senior space who are not quite sure what the future may look like in terms of this expanded scope and role that pharmacists can play right from their very own homes. So this is integral. This is the future. We have to get towards the model of value-based care, and deprescribing is a piece of that. So yes, we want to educate our doctors and our patients, but it also comes down to a policy reimbursement. We got to start talking about how we can change our broken fee-for-service model. It's clearly not working, and it's clearly the most expensive healthcare in the entire world. So what are we doing about it? First thing we can easily start doing is talking about leveraging your pharmacist. Have you connected with one, or do you have one who's maybe in their own practice and they're trying to figure out how they can expand their use? We can integrate seamlessly into senior care organizations and provide such valuable impact that could be in itself marketable, and of course can be better for patients who now see the trust develop between your care organization, your own pharmacist on retainer, and better care for the patient. So we're seeing it from the back end. But I am so pumped for how our cohort is responding. They're already thinking about ways to integrate some of our clinical tools into their business, into their own patient lives, into their loved ones. They're going to go out and start conducting and having dialogue, because it starts with the power of conversation. But more importantly, it starts with telling your story and why deprescribing matters to you. So I tell you all day about the impact about my grandma, which influenced my decision into becoming a geriatric pharmacist. She unfortunately was overprescribed while she was in a nursing home and given ziprasidone, which is an antipsychotic, to treat her illness of dementia. It was mild cognitive impairment. And that unfortunately worsened after being given ziprasidone. And this left my parents in a bit of a rut. So it's personal for me, but I feel all of us have this same story. And that's who I keep meeting. I keep meeting people in my cohort who see the over medication day and day and again. And the best they can do is try to get recommendations to reconcile the meds that may be off, right? But no one seems to be thinking about, wait, why are we waiting for a train wreck to happen? Like, why are we waiting for an ER visit? Why are we waiting for the worst case possible scenario until we decide to talk about stopping unnecessary meds? This needs to be everyone. It just needs to be everyone. If you're on more than 5, then we got to start talking about what can we do to deprescribe. I am telling you, the power is yours. And I'm not Captain Planet, but I'm telling you that this starts with a conversation, starts with a dialogue. It starts with trust and empathy. And we can leverage deprescribing to be the norm. And I promise you, I want this taught in our medical schools. I believe this can be taught in our pharmacy curriculums. I believe all clinicians who are in this space can benefit and learn from deprescribing and leverage those tools to better improve their patient care. So we got to do away with our old broken healthcare system, guys. It's old, it's expensive, it doesn't work, and it's not accessible for everyone. So what can we start doing now? Start leveraging your pharmacist, start using some of those clinical tools and basic patient pamphlets that you can disseminate to start the dialogue. That's step number 1. And there's more to come if you check out our Deprescribing Accelerator. We're going to have another cohort launch, likely the end of May and June. So sign on up. I'm still taking applications. You could join our waitlist. I'll be looking forward to meeting you and seeing you grow and leverage deprescribing as an added potential revenue stream, but most importantly, because this is what we have to do spiritually and as a clinician to fix this broken healthcare system. I'm Dr. DeLon Canterbury. You guys take care. And of course, I'll see you next time for our next discussion. All right, later. Comment below what you feel and what you think. Take it easy.